All right, so if you're following the World Cup, then you may have seen that Brazil's superstar forward Neymar Jr. suffered a severe ankle sprain against their World Cup match against Serbia. So what exactly is an ankle sprain? I'm going to explain what they are in this video. So at the end of the video, I'll show you exactly what the treatment options are for this, and drop a comment below if you want to hear more about this. So to begin with, Neymar had suffered an injury after a heavy tackle by Serbia's Nikola Milenkovic. He was sidelined from the game, walked off. You can see some pictures here of the swelling in his ankle. It's not too bad, and the swelling is in the area of the lateral malleolus. So let's take a look at the ankle. So we're looking at a 3D model here. We can kind of zoom around and I will show you exactly what we're dealing with. So this is the head-on version of the ankle. This is the side. This bone here where my pointer is the fibula. And most ankle sprains are called lateral ankle sprains, and that means they involve the lateral collateral ligament of the ankle, known as the anterior talofibular ligament. So if we zoom in here, you're going to see this ligament here, which is your anterior talofibular ligament. And more than likely, that is what was injured in Neymar. When I say more than likely, it's hard to tell without an MRI. There is another ligament there called the calcaneofibular ligament, and that's what this is here. And that also can become injured in a lateral ankle sprain. And this is when your foot is turning in, and you'll see the lateral malleolus or the ankle bone kind of pop out. So I'm going to highlight this again, this yellow ligament here. That's your anterior talofibular ligament. It's under this little retinaculum you'll see here, and it attaches onto the talus bone, which is this bone here, and that prevents the foot from turning in and kind of subluxating. So what do we do for this? Typically, we just rest it, put the patient in a walking boot for about 3 weeks. Sometimes we will use crutches, and typically we'll use crutches until they're able to bear weight without pain. Once they're walking without pain, we have them walking in the boot, and then they're rehabbing daily. They're using range of motion exercises, strengthening exercises to get that ankle range of motion going back quickly. And then from there, they regain strength. Sometimes we use an ankle brace when they get back to play. It all depends on the athlete and the performance and whether they're comfortable in it or not. Ankle braces and taping have shown to increase the patient's proprioception, which is their ability to feel the ground and function in response to their activity, making those muscles fire to stop the ankle from spraining. This is a good time to talk about the difference between a functional ankle sprain and a structural ankle sprain. So when you tear or rupture the anterior talofibular ligament, that is a structural ankle sprain. And you can regain your strength by strengthening the lateral musculature of the ankle, which is the peroneal tendons. And there's some other tendons, but that's the main one. And if you can strengthen that, you can have a functionally stable ankle. Some patients, however, will rupture their ATFL and end up going into having a weak lateral ankle, and then they have to have it repaired. So typically, we won't repair these acutely. So Neymar most likely won't have surgery to recover from this. He'll go through some rehab. Once he's functionally stable, he'll go back into activity. If they need to have it repaired, we usually make that decision later on. If they continue to sprain their ankle, they're having chronic pain, sometimes we'll go in with an ankle scope and look at it. And if the pain isn't responding to any conservative therapy or physical therapy from their athletic trainers, then we'll consider going in and doing a repair of this anterior talofibular ligament. But this would be after multiple sprains, or if they're walking off of a curb and they continue to sprain their ankle, then that's a time where we'll consider moving on to surgical correction. So I hope that answers your questions about lateral ankle instability. If you have any other questions, drop them in the comment section below. I'll be sure to do my best to answer them. If there's anything else you want to see or learn about, put it in the comments section below. Please make sure to subscribe for upcoming videos.